Let's talk about diagnosing autoimmune encephalitis. I will preface this by saying that even if a lot of this workup is negative, a lot of physicians do treat based on clinical suspicion, and I think that's totally reasonable. We'll talk about treatment in a different post. So some things we do to help diagnose: basic blood tests as well as autoimmune panels that we look for in blood. We also look for the same autoimmune panel in a spinal tap, and that looks for antibodies in cerebral spinal fluid that surrounds the brain. This is done via a lumbar puncture. An EEG can be helpful if you're having seizures in conjunction with the autoimmune encephalitis, which happens pretty frequently. And then lastly, an MRI brain is helpful because it can show swelling of the brain in different regions affected by the autoimmune encephalitis. Very commonly, you'll see it in the bilateral temporal regions. Lastly, if there is a history of cancer and you're worried about a perineoplastic syndrome, which is autoimmune encephalitis in relation to a cancer, you can do a PET body to see if there's progression of the cancer, if there's cancer in other regions that might be affecting this autoimmune encephalitis. Very lastly, I will add that I did mention an EEG, but more often than not, a video EEG is more helpful than just a regular EEG. So blood test, CSF analysis via spinal tap, EEGs, a PET brain if need, or a PET body if needed, and lastly an MRI brain. Those are some of the few tests we can get to diagnose autoimmune encephalitis. Of course, as I mentioned, even if any of this stuff is negative, we call that seronegative autoimmune encephalitis. It can be. Most physicians will elect to treat based on suspicion.